Hello, everybody. Thank you very much for joining our today webinar, which is about sanctions, health, and conflict. We have two speakers today, Reza Majdzadeh and Jerg Gutman, and I have a pleasure to introduce them briefly. And the plan is that each of them would talk about 20 minutes and present their research. And after that, we would have around 30 minutes time for question and answer. Please use the question and answer box in the Zoom for your comments or any question that you might have during the presentation. And we come back to your comments and questions at the end of second presentation, Mr. Gutman. So let me directly start by a short presentation of biography of Reza Majdzadeh, as well as Jerg Gutman, and then we give the floor to Mr. Majdzadeh to present his talk. Reza Majdzadeh is a global health scholar at the University of Essex with over 25 years of experience in health system research and policy. His work bridge health policy, evidence-informed decision-making, and the geopolitical determinants of health. Uh, as a former head of Iran's National Institute of Health Research and WHO consultant across several Middle Eastern and North African countries, his recent research examines how economic sanctions and related crises constrain health system resilience and progress toward universal health coverage, particularly in fragile and crisis-affected settings. His talk today, as you see also already this slide, is about sanctions and the population health. And once that he has done with that, we come to my colleague Jerg Gutman, who is an assistant professor of behavioral law and economics at University of Hamburg in Germany. And his research is at the interaction between economics, law, political science, and focuses on challenges to the rule of law, the relevance of constitutions in organizing societies, and also the determinants and the effects of international sanctions. Broadly speaking, Mr. Gutman is interested in the use of government coercion and how it can be limited. He has published several articles on the consequence of international sanctions for both citizens and economies of target countries. So he would also talk about the effects of sanctions and the internal conflict for the case study of Iran. With this brief introduction, I would like to invite my colleague Reza Majdzadeh to start his talk on the sanctions and the population health. Reza, the floor is yours.
Thank you so much. Thank you, Mohammad. Thank you for having me. Initially, I should say that I remember that 2 years ago, I have attended the same meeting as the attendee, and we became acquainted with the Mohammad. And for that time, we are working all together. Right now, we are a team. You will see let's say, the work that we have done with Mohammad, as well as Jerg. I have privilege of working with them. And I'm delighted that I'm going to explain to you not one research. I'm explaining let's say, the chain of research that we have done regarding, in particular, the economic sanction. Let me start with this image. Today, I'm talking about mortality, about morbidity. But I want to say that these are not just numbers. These are human beings that they are losing their lives. And many of us had this living experience of dealing with sanction. I took this image to say that ethically, we should consider that what we are talking is about human being. It's an Iranian cancer patient at her parents' house. And I will explain to you to what extent sanction can affect, let's say, procurement of medicines, access to facilities, and so forth, the other, let's say, aspects of the healthcare. Okay,
Reza, we don't hear you, so you're mute.
Okay. Should I start from the beginning? Yes?
Yes, please.
Okay, I should go to the, let's say, first slide. Sorry, I didn't realize that. Okay. In the first
That,
slide.
in
Okay.
first slide we heard you, but the outline
Okay. From the
okay.
outline.
Yeah,
Okay.
sure.
So we have 4 areas to talk. What exactly are sanctions? What happens to health when economies are punished? Why do harms persist? Why do harms persist, even with humanitarian exemptions? And finally, what would evidence-based safeguards look like in practice? So to start this, I should have some, let's say, sort of definitions to set the scene. What exactly are sanctions? Sanctions are restrictions that limit the freedom of a state, a group, or its leaders with the aim of compelling policy revisions or inducing political change. This is the definition. And we have different types of sanction. In particular, I want to actually distinguish between, let's say, unilateral coercive measures that a state or a group of states can decide on, let's say, imposing this type of sanction versus United Nations Security Council sanctions, which is endorsed by the, let's say, United Nations Security Council, and it is based on the item 7 of the Charter of United Nations. And it has its own regime, and legally it is legitimate. But the unilateral coercive measures are not. It could be arms embargo, restrictions on admission, and economic sanction, which is the main topic of the talk today. And what is economic sanctions? State or organization impose restrictions on trade, finance, or services with a targeted actor to pressure policy change. This is the main topic that we are talking today. And I want to say that typically food and medicines are excluded from sanctions, but are usually affected. Why? Because if they are working, they must also hurt. It is economic sanction. So it should disrupt trade, let's say, selling goods, buying goods, and all of these. But the rationale behind, let's say, sanction is to resolve a conflict without mass suffering and other negative consequences associated with war. So with this definition, I want to show you this figure, which is very important. And you can see the increase in the number of sanctions globally, how it is moving forward. In particular, after 2010 and 2015, sanctions are going to be one of the main, let's say, diplomatic tools in foreign policy, because countries have decided to not, let's say, involve with the war, and they decided to go with the, let's say, other types of, let's say, political and diplomatic measures, which is the sanction. Therefore, this is the reason that we are hearing much more, and it is very common practice across the world. So let me start with the second item, which is about health. What fails first and for whom? For this purpose, I'm starting with the paper that we have the first author with us. Jerg has published this paper, which is very important paper. And they look at the, let's say, 98 countries from 1977 to 2012. And they look at the life expectancy and the difference between male and female. In different sanction episodes from the United Nations, as I mentioned to you, and United States. I'm not going to the methodology right now. We can return back to that topic. But the conclusion is that United Nations sanctions, which is very important, it is United Nations. reduce average life expectancy by 1.2 to 1.4 years during a sanction. Just for your information, COVID reduced 1.3 years. I want to say how it is massive. And in their paper, they have mentioned that there is a difference between male and female, but the US sanction reduced life expectancy less than United Nations sanctions. This is the first important piece that we are talking about. The second is the recent paper published in the Lancet Global Health. And Francesco Rodriguez and colleagues look at 152 countries, and they look at the age-specific mortality rate, and they found that in particular, under 5 and older adults are mostly affected by the sanction. The alarming statistic is here. They estimated more than 500,000 deaths per year attributable to sanction, more than death from war. But where is the debate here is that they have seen it in the US sanctions, but not statistically in UN sanctions, which is the land for discussion. Why there is a difference between previous paper and this one. But what we can see is the strong evidence on the effect of sanction. We have two main reviews on the impact of sanction on health. One of them is what have been published by Matthew Pinto and colleagues in BMJ Global Health. And they look at the, let's say, 27 studies. And you can see that among them, 21 showed the impact of sanction on health. You can see mortality, morbidity, vaccine, healthcare, let's say biomarkers, laboratory devices, etc. So far, I want to tell you that we have strong evidence on the effect of sanction, and you have seen the magnitude of effect. In the case of Iran, I can see among, let's say, colleagues who have attended, many of them are from Iran, which is very actually understandable. We have done a study on the data from 2000 to 2020, and we look at 28 indicators from macroeconomic, health care resources, and health outcomes. And we look at the change in the, let's say, the point of this sanction from 2009. It was a joint point regression analysis. And we had found just 5 indicators which worsened, which is out-of-pocket payment, household expenditure on food, chronic respiratory system disease, thalassemia, and hypertension. So I can return back to this discussion, whether it was due to methodology, it was, let's say, health system resilience, or a policy buffering. But in Iran, this is what we have seen based on the, let's say, national and subnational data. Another study, which is subnational, they look at the disability adjusted life years, and they look at the major diseases and risk factors. As you can see, from the time that sanction has started, the slope of, let's say, improvement in indicators is decreased. Therefore, we have evidence on, let's say, the case of Iran in non-communicable diseases. One of the papers that we have worked with our colleague, we had reviewed, let's say, economic sanction effect on Iran in child studies, and we have published this in 2022. And we have seen very similar to what I explained to you. Higher mortality rate in chronic and child health, increased disease severity and mental health problems, we found a paper that they are showing that more than 6 million patients could not actually have access to the adequate treatment, and increase in drug prices and availability of asthma medicine, as well as food costs and insecurity. Also, the effect of sanction on inequality. So when I'm talking about inequality, we look at the intersectionality as a part of, let's say, inequality, to have a lens of intersectional inequality. I should say that sanctions do not affect all lives equally. They magnify existing inequalities and entrench vulnerability. Assume that a single mother skips her hypertension medicine to feed her children, or a child labor discharged after surgery cannot afford a day of sick leave, or in particular, people who are living with disabilities and their access to the assistive technology is disrupted because of the sanction and affordability of devices. Therefore, I should say there are no peripheral stories. They are the human geometry of injustice. So I covered two of the, let's say, items of my talk about definition and what happens to health when economies are punished. Right now, I'm going to explain to you why we have this. Despite of the, let's say, humanitarian sanction, initially, I'm not going to explain to you the effect of sanction on the oil revenue of Iran. And I think for the you as, let's say, mostly economists, it is very clear to you. But what I want to add to this is that because from 2010, they said that we have a smart sanction. I want to say that the pathway of the effect of sanction on health is not only through, let's say, import and export. It can affect, let's say, in many ways, blockage of the, let's say, banking transfer, over-compliance, chilling effect. I will explain later on. And all of these, in addition to the corruption that I know Mohammad has worked on it, can affect health of people. Therefore, if we actually think about import restrictions and making sanction smart in one item, to be honest, the other ways are there. And we cannot block all, let's say, pathways to the health of people. I'm just giving you one example. I know examples from Syria because, as Mohammad has mentioned, I work in the Middle East and North Africa, as well as Iran. But I'm just showing you one example from, let's say, North Korea, that the way that they want to actually to change one chipset in the, let's say, MRI machine. Sorry, this case is X-ray. I have another one, which is the MRI. And okay, they should identify a vendor. Based on these resolutions, it is very hard to find a vendor to accept selling this, let's say, device to the, let's say, to the Minister of Health of North Korea. And then when they have that, they should have, let's say, hard currency to purchase item. And it is not possible because of financial sanctions. The third item is that they should transfer this money to the vendor. And you can see many banks are not accepting because of, let's say, over compliance. And when it reached to the shipment, let's say the Chinese who are, let's say, usually they are using for shipment of the goods, they are not actually accepting this shipment. Therefore, I want to say that we are facing with many things. Blockage, which is the direct legal or financial barriers. This is the case of sanction. But I want us to not undermine over compliance, which is the excessive caution by companies or banks, avoided even permitted humanitarian trade to reduce risk. I have many examples on this on medicines. And chilling effect, which is the wider climate that companies do not want to work with the, let's say, with the state which is under sanction. So when we are talking about sanction, we should look at the type and to see what is the health outcome of it, regardless whether it is intermediate, long-term, and considering equity. There are many pathways and details which can affect health system functions. Access to essential products, service provision, emergency capacity, health financing, workforce, immigration, health information system, and health governance, as well as the social determinants of health, food security, migration, and displacement, etc. So what we can do to reduce harm of sanction. This paper that we had worked with my colleague, one of my colleagues that we work mostly on the topic of sanction. We look at the, let's say, different mitigation measures across the board, and we have interviewed 10 national experts, and we shortened, let's say, the list of interventions. And we have conducted the Delphi consensus, and we have asked about feasibility and effectiveness of different mitigation measures to reduce the effect of sanction in long term and short term. And you can see here, and I can conclude that we have different core measures in financing, governance, information system, and service delivery within health system to reduce the, let's say, the harsh effect of sanction and to make health system resilience. But in this paper that it's going to be published in May 2026 and has been accepted, we look at the 7 primary research that we have done from 2015 till 2024, and we come up with that idea. We can do something at the national level. But to be honest, the most powerful way of reducing sanction is not to be under sanction and not to impose sanction. This is important. How you can avoid sanction. At the international level, we reach out to the conclusion that we need a binding legal framework for sanctions. We should protect humanitarian corridors for medicines and medical supplies and create accountability mechanism for sanctions state. Regarding human consequences, it is very important. You are responsible for those things that you are doing. The question of us is that how we can make sanctioning entities accountable to what they are doing. So during last few years, we worked on the different aspects of it, and we tried to have that advocacy about the harsh effect of sanction on Iranian health. It has been published. It is correspondence. All of these are correspondences in the Lancet, which is, let's say, has high visibility. Then when President Biden came into office, we said, okay, we want to start with the nuclear deal. Let's give the health a priority. Because you are saying the sanction is smart. We do not want to harm people. And okay, the other side is thinking that it has harm. Okay, define that. The third one was when we published this paper, when we have seen the first sign of the, let's say, international humanitarian aid agencies has started work on, let's say, sanction. And we encourage this approach to the, let's say, looking at the initiatives at the international level. I'm very happy that World Health Organization Eastern Mediterranean Region Office has that initiative, but it is promising, but it is really late to do that. We published another piece recently, and we had this item that, okay, we can go with the, let's say, national level resilience measures, but we should not forget liability for those who are imposing sanctions. And this is the last piece that I have privilege of working with Mohammad and Jerg and other colleagues. And we published a piece in the Lancet that we discussed about different measures, how we can reduce the impact of sanction. I have two other points in this slide to say that these are 5 main measures. We should be ensure the sanction regime in the first day has very effective functioning of humanitarian exceptions. We should treat overcompliance as a discriminatory and legally accountable practice. We should monitor, because if you are talking about, let's say, accountability, you should monitor what you are doing on, let's say, different aspects of sanction, in particular essential medicines and equipment, access to the, let's say, health outcomes, financial protection, food security. And finally, we should actually ask sanctioning entities to establish an independent oversight body to report on proportionality and the right to health. There are some initiatives right now. In 2004, OCHA has actually published a handbook on indicators for assessing health impact of sanctions. In recently, United Nations Special Rapporteur on unilateral coercive measures has started an online tool for assessing the impact of sanction, unilateral coercive measure. And recently, Eastern Mediterranean Region Office actually started a tool. They call it SHAMS because it is Sanctions, Health Assessment and Monitoring Support, to shed light to the, let's say, to the impact of sanction on health of people. And I'm finishing with this slide that these are my take-home message. Sanctions, like war, destroy health. I should say even more, only more quietly and more slowly. All economic sanctions are, in practice, sanctions on health. Evidence that they cost lives should be enough to demand restraint. And without metrics, sanctions policy remains publicly without accountability. I'm handing over to Mohammad. Just before that, I should acknowledge all of colleagues have contributed in this presentation, and you have seen their names. And in particular, I want to mention the name of Dr. Majdzadeh, Dr. Moradi, Mohammad Farzanegan, Jerg Gutman, and Ruth Gibson. Thank you so much, and over to you, Mohammad.
Thank you very much for this informative presentation, Reza, on how sanctions are costly for the population health. We come back to you with some question and answer session. So let me directly hand it over to my colleague here, Gutman, to also talk about the research on the sanctions, intensity, and internal conflict for the case study of Iran.
Thank you, Mohammad. I hope you can see the slides.
Yes.
Okay. So listening to two talks, I think can be tiring for the audience. So I try to be concise in my presentation. This is joint work with Mohammad on sanction intensity and internal conflicts, a empirical study on the case of Iran. And the specific feature, the unique characteristic of our study is that we are looking specifically at sanction intensity, which is something that studies have so far largely ignored simply because data is not available. So most empirical studies looking at sanctions, they measure simply the presence or absence of sanctions and compare whether this makes a difference. Now, in the case of Iran, we have interesting data that measures the intensity of sanctions. And so this is what's specific about our contribution here. But I will come back to that. So sanctions, as everyone might be is certainly aware, are often imposed with the specific intent to destabilize governments. So they often have a political goal, and the goal is to put pressure on the government, be it with the goal of regime change or simply pushing the government to change certain policies. Now, how these regimes exactly are affected by sanctions, independent of what the goal of the sanctions is, this is less clear because we know on the one hand that sanctions trigger protest, create unrest, but at the same time there are both theoretical articles and empirical studies showing that there is sometimes a rally around the flag effect, which means that people unify behind their government rather than oppose it when the government faces sanctions. So this is a question that we try to understand better in this study, how these opposing arguments somewhat can be aligned, how these can be understood, and whether there might actually be fewer contradictions between them than it might look like at first sight. So we are studying here, as I already mentioned, the intensity of sanctions, how it affects internal conflict. And we try to answer whether this is the case, but we also try to answer a second question, which is whether different forms of internal conflict are affected differently. So we will be distinguishing between civil order, this is things like protest, which I already mentioned, but we also look at measures of terrorism and civil war as more severe forms of internal conflicts that might be affected by the severity of sanctions. So let me very briefly talk about the theory, because this is very critical to understanding why it might make sense to look at different forms of internal conflict as outcome measures. The main theory that is often referred to, and which is really the motivating theory for using sanctions, is grievance theory, which is based on the vast empirical evidence that economic sanctions worsen economic conditions and also other outcomes like health outcomes in the target country. If this is the case, which seems to be supported by almost all the evidence we can find, then this should increase dissatisfaction in the population, and this dissatisfaction should then translate into reduced political stability, should undermine the support of the regime and thereby pressure the regime to either make space for someone else or change its policies. So this is the theory which stands behind why governments choose to sanction. However, there are other theories which also deal with the consequences of sanctions. One of them is bargaining theory, which simply understands sanctions as the outcome of a failure of bargaining. Essentially, if we, as economists, when we think about sanctions, sanctions are always inefficient. If we could anticipate the outcome of sanctioning someone, essentially, I'll not go too much into the technical details, but there should be some Cauchy bargaining essentially going on. So in a world of full information, we would not observe sanctions. If sanctions are a powerful threat enough, the government will concede and will change its policies. If the threat of sanctions is not powerful enough, then the sanctioning government will not use them in the first place because it's also costly to them. And if they would not be successful, we wouldn't impose them. So in this bargaining theory, the idea is that sanctions are essentially a failure of information asymmetries. So the fact is simply that sanctions are used because information is incomplete, and also the resulting conflict is along the same lines a consequence of the lack of information on both sides, or the inequality of information between both sides. And so the idea of bargaining theory is that sanctions can actually reduce information asymmetries regarding the outcome of potential conflict by signaling that there is support for certain parties in a potential conflict. So when you are thinking about would you, for example, as an opposition politician, want to challenge the Maduro regime, if the US imposes sanctions on that regime, that might be a signal that the US would support you in these efforts. And not only do you understand that signal, but also the population receives that signal, receives the same information, and the government itself receives that information. So essentially, what this means is that information asymmetries are reduced due to the use of sanctions because they might convey credible information regarding support of different parties in the conflict. And that might then also reduce the risk of an outbreak of civil war, because civil war, just like the use of sanctions, is something that occurs because of bargaining failures. So the overall prediction of bargaining theory, therefore, would be that sanctions reduce the likelihood of civil war by providing all the involved parties with the same credible information. The third theory that comes into play here, I've already mentioned, is the rally around the flag effect, which says essentially there is some political psychology, sociology effect going on. Sanctions essentially increase government support by unifying the people behind the government in light of having a joint external enemy. So the government can exploit that for propaganda, or citizens just by themselves decide that in light of this external threat, they now support the government, which they might not have supported or not supported as much without the sanctions. So this effect could also indicate that the risk of large-scale conflict could be reduced because you will find large shares of the population behind the government, even if individuals would still be willing to protest against the government, even if individuals would be willing to carry out terrorist acts in the country. A large share of the population, due to the rally around the flag effect, would be expected to support the government, and that would essentially undermine any effort at starting a civil war to remove the government. So we see that these are opposing theoretical arguments. The grievance theory essentially says any kind of conflict should intensify, but bargaining theory, as well as the rally around the flag effect, would argue very severe conflicts that aim at removing the government for different reasons could actually become less likely to occur, should be less attractive under sanctions. And this is what we want to test here. Sorry, wrong direction. So our first hypothesis is that increasing sanction intensity increases the likelihood of internal conflict in general. But then we will specifically test whether increasing sanction intensity reduces the risk of civil war. So we think specifically civil war, due to bargaining theory and the rally around the flag effect, should become less likely when sanctions are imposed. Okay, so what are we doing empirically? We have time series data here covering the period from 2001 to 2020. This is quarterly data, so 4 data points per year. And we are looking only at the case of Iran, for which we have the data. And this is a wonderful data set from a paper by, and sorry for butchering the names, most likely Laudati and Passaran. So they have a great data set, which I can only strongly recommend, which measures, based on news reports in US and UK news media, the intensity of sanctions. So there are other indicators which follow a similar methodology. This is very fashionable right now to measure things like geopolitical risk and other kinds of risk factors. But this is the only indicator I'm aware of that focuses on the use of sanctions and is specifically produced to measure sanction intensity in Iran. We also have data for internal conflicts, and here we have to rely on ICRG data. These are expert assessments. This is very important to be aware of. This is subjective data. That is a limitation, but on the other hand, this allows us to have quarterly data because these expert assessments are recorded quarterly, whereas the regular kinds of conflict data that you will otherwise find is usually annual data, which makes it very difficult to produce such a time series analysis. In terms of estimation, we'll use vector autoregressive models and produce the impulse response functions and variance decomposition analysis. This is just to give you a brief illustration, a feeling for the sanction intensity index that we are using. This is from the original publication introducing the data set. And as you can see, the trends in sanction intensity that is measured by the data very nicely follows real-world events. So this data set seems to be very much in line with how sanction intensity evolved on the ground. So as I said, it's a data set that I think could be of interest also for many others here. Okay, so our main findings in a nutshell, we find that as expected, sanction intensity increases lead to a higher risk of civil disorder and terrorism and of domestic conflicts overall. But for civil war, we find, as anticipated in our theory, that the risk is reduced. Now, I should emphasize we are talking about expert assessments of the risk of civil war, because there was no civil war. So don't get confused and ask, okay, which civil wars are you referring to in Iran? So this is not about an actual civil war. These are perceptions of the risk answered by experts. And these experts, when sanctions are more intensive, answer the question regarding the risk of civil war as being less severe. We also, in line with the previous evidence, find that economic downturns are created when sanction intensity intensifies, both in terms of lower GDP and reduced oil exports. I'll very briefly go through the figures since I'm not sure whether everyone here wants to see the technical details in too much detail, but here you can see that the effect in terms of reducing internal conflict lasts for around 1 year. The effect regarding, now we are coming to the 3 dimensions, the effect regarding civil disorder, you can think of this as protest, lasts a bit longer. This is increased for around 1.5 years. You have a rather short-lived intensification of the terrorism risk for around 1 year. And then the civil war risk is reduced starting about half a year after the intensification of sanctions for about 1 year. We also have a bit of validating evidence in terms of the potential mechanisms. We looked at the World Value Survey data for Iran in the years 2005 and 2020. So this is supposed to support our story regarding the reduced civil war risk due to intensive sanctions. And what you can see is that during this time, the willingness to fight for one's own country, so the willingness to fight for Iran, has increased from 70 to 73%. And the share of the population that stated that they are very proud of their nationality increased from 63 to 83%. So this is the comparison from before serious sanctions to during and after major economic sanctions. So we think this at least supports our story that there is this rally around the flag effect going on in Iran. Okay, and I think I'll leave it at that since I should be out of time. Thank you very much.
Thank you very much, Jerg, for this presentation on sanction and internal conflict. So we have some time left for general questions, and we encourage also our participants to raise a question in question and answer box. So we have received one question from one of our participants. So I'm going to read that, and that may be answered by Reza or Jerg, as you wish. So the question is that it is asked that we all know that the sanction cause of many problems, including all the aspects that Reza, for example, said on the health issues and environmental issues and pollution, water scarcity, and so on and so forth. So the participants is asking why we focus on single sanction and why we do not consider political and central government plans, which leading to the sanction and as well as other issues. So that is, I guess, a question that often comes, that all these degradation in the health, public health, and other difficulties that we do see in countries under sanction is due to the effect of sanctions, or this is again the role of mismanagement, the governance, and so on and so forth. So basically, what percentage of all these problematic picture that we partially saw in the Reza presentation, and also in the case of Jerg on the stability of the system, is due to the sanction, and what share of that can be attributed to the role of governance. I know that is rather difficult to identify and quantitatively basically explain, but maybe you have also some feedback on this question. Maybe Reza.
Yeah, initially, thank you so much. It is an excellent and very important point. To be honest, from time to time, we are facing with this question. Many people I have seen recently in the Twitter of Mohammad that somebody responded very similar to this, that you are not considering, let's say, the internal politics and what is happening over there. And we do not want to look at this solely on the sanction, definitely. We are thinking that these are the people who are suffering. And in particular, I want to say that holy crisis, just let's get back to the corona. What happened during corona? It is a poly crisis, having a pandemic plus sanction. Can we reduce the burden because of one of them at least, or not? I want to say that in one of my slides, I actually mentioned the work that colleagues have been done on corruption and sanction. And you can see that, no doubt, it is complex. It is a syndemic phenomena. But what we are trying to do, we are trying to find that part that we can, let's say, discuss. I'm not ignoring the rest of the, let's say, factors. I'm saying that we should look at each one of them, but is it fair that we were imposed by the sanctioned entities and to not have access to the medicine? Two other points that I want to say, that, but I'm taking your point and it is completely valid. But I want to say that we are not ignoring that part. We should consider all of them. For the, let's say, for measuring, yes, we need, let's say, how we can have that level of, let's say, methodology rigor to see the effect of sanction, but it is not the effect of sanction per se. It is combination of this, let's say, sanction with the other factors that you have mentioned. Two other things that I want to say is that the first one, I have seen similar discussion when I talk with the colleagues who are working in case of Venezuela. And they have same discussion. This is due to, let's say, the mismanagement at the country level, or it is due to sanction. These are the topics that's okay. I want to say that we are acknowledging all of these complex phenomena. At the end of the day, I didn't want to go to this case. Okay, but my mother passed away 3 years ago because of nosocomial infection, hospital infection. And despite of my wide network to the colleagues in pharmaceutical companies, pharmacies, etc., we could not find the specific antibiotic. Can we reduce that mortality? And you can feel why sanction is important for me, because it is really affecting life of the people. The last point is that you have mentioned that right now we know that sanction is the cause of this and that. To be honest, it is not something that at the international level, sanction entities are. I have seen, let's say, I do not want to point it out, let's say, specific entities at the moment, but I have seen that in many occasions, they do not accept sanction as something which has harsh on the health of people. This is the reason that I mentioned that the first thing that we should do is advocacy. To advocate that sanction has these side effects. And I think this is the social responsibility of us to do that. Stopping here, I think maybe Mohammad and Jerg has to, let's say, have similar experience on this combination of complex
maybe
entities.
given the fact that thank you Reza for sharing your experience. Jerg, you have done also empirical research on the effects of sanctions, and probably you also face this question: is it sanction or something related to the quality of governance? What type of strategy you have to separate them?
So my answer would have been a bit evasive. It depends a bit on the question that you're interested in. I think when you are providing advice regarding how to manage a health system, then you are addressing both maybe the sanction sender, but you might also be addressing the government. And in that case, one might think about, okay, who has responsibility for what failures? So for that specific question, I think that it makes more sense to think about, okay, how much of this could have been avoided if the government managed the problems more efficiently. But then again, are we sure that any government is actually capable of doing that? We can speculate, but comparing governments to perfect outcomes is not realistic, because governments never deliver perfect outcomes. When we are looking at things like conflicts, then I would say the government is not really the addressee here, because the government is not interested in experiencing conflict in the country. And essentially, you are advising the sender of the sanctions whether it's a good policy to impose these sanctions, and what kind of instability do they create. And then we observe, okay, there is an equilibrium outcome. Certain kinds of conflicts intensify, others might be weakened. And this might be an equilibrium in the sense that citizens react to the sanctions, but also the government reacts to the sanctions. And overall, the equilibrium outcome is that we observe more of this kind of conflict, less of that kind of conflict. In that case, I don't really care so much where this is coming from. Is this due to the fact the government uses more repression or less repression? It's not so much the question, but the primary question is, do we see more or less civil war risk? Do we see more or less protest? And that is simply what we observe. So I think it really depends on whom do you try to advise with your evidence, and what is the subject matter that you're interested in. But I think oftentimes these equilibrium outcomes are sufficient for us. I'm not sure whether I should already respond to the second question on the list.
Yes, I wanted also, in our study, which we talk about the effect of sanction on the size of middle class with another heavy B. So we also faced this point by referees in which, well, at least they asked that we acknowledge that the effects that we are measuring is the overall effect of the sanctions. That means the sanction distortions on the different markets, which clearly result to increasing poverty and decreasing the size of middle class, but also the intervention of a state under the sanction, the reaction policies, the policies that the government in reaction to the sanctions may initiate in controlling markets and multiple exchange rates, subsidizing and so on, so which might result to more rent seeking and corruption, which at the end translate to weakening of the middle class and other deficiencies. So it's a kind of combined effect at the end, right? But it is clear that the trigger factor, I mean, without the sanctions, the situation could be different. So the methodology could also help to somehow control these things. So in the middle class paper, we've used this synthetic control approach in way that you will the twin of Iran before the sanction, which were not that far from the quality of governance than the governance of Iran. So what is then different is the sanction itself after that. So there are possibility to capture the impact of the sanction, but at the end of the day, it is better that we call it the combined effects of sanction, the total effect of sanction, which includes also the domestic reaction to those sanctions. And yeah, so maybe the second question, Jerg. So the question is, do you have your survey results by ethnic group?
I can be very brief on that. I already looked that up on the site. I briefly opened the World Value Survey documentation, and it's a bit disappointing for what you might have in mind. So there are ethnic groups, but they distinguish them very broadly. So there's a category 5, which is Arabic and Central Asian, and that's about as specific as it gets. So if you want to have more fine-grained ethnic distinctions, then this is not the case. So it's by very, very broad categories only.
Right. Okay, yeah. Saeed Mushiri is asking also for your the second presentation, Jerg. A question for Jerg on the methodology. What is your identification strategy? Internal conflicts and terrorism have been around long before and after the sanction. How confident are you that the sanctions have caused the conflict?
Yeah, so I should first say honestly that this is more of a question to Mohammad than to me, because he's the time series econometrics expert. I'm more of a cross-country person myself. But what's important to understand is our study is not about sanctions or no sanctions. It's about sanction intensity. So what we are looking at is what happens if the intensity of the sanction would increase, and what happens in the aftermath of that. And this is what we are estimating. So this is what the identification comes from. If the increases in the sanction intensity do not coincide with other events that we do not account for systematically, then we can measure these shocks or the response to these shocks and attribute them to this increase in sanction intensity. So that is where our causal identification comes from. It's standard assumptions of vector autoregressive models. Yeah, nothing very specific here. Sanctions were there before and might be there after our study. But it's really about how the intensity evolves over time during these 20 years.
And we basically simulate the response of different types of conflict, internal conflict, to a positive shock in the sanction intensity, right? Is not a kind of in that a strong way of causality analysis. Is basically learning from the past development of the data to predict or to simulate what will happen if a similar positive shock to the sanction intensity happened today. How these different types of internal conflict react or response to that positive shocks in the forthcoming period. So that, or the various decomposition analysis may explain that in other way. So it's a more kind of simulation here. But you're correct. I mean, we are not talking about sanction before and after the sanction, but is rather sanction intensity, which has been a continuous index according to the calculation of Pesaron and Lodati. So this is what we can say for the moment. So another question again from the first participants, Mr. Atto, who raised the question of governance. I guess is not maybe a question and comment. For example, he raised some, give some example. There are many areas in Iran which facing high poverty and health issues, which are not directly because of the sanction impact, how you can separate in your result which are the sanctions and which are the other. But I guess we somehow reflect on that. So I'm not sure if Reza, in your presentation, you basically referring to many examples that you have on over compliance, the sanction which has created problem in that sense for medical health sector of Iran. Do you want to share some of these real experience that you had, which is not related necessarily to the role of Iranian government, so that is really can be attributed to the sanction itself?
No, thank you so much. That's a very good point that Mr. Atta has mentioned. I do not have any, let's say, problem with that. Sanction never work in isolation. And then as we have mentioned, it is, let's say, a complex measure. I have many examples that the effect of sanction relieved even, let's say, during this period of time because of, let's say, better management of the system. I have those examples, and we do not have doubt that sanction is not working alone. It is, let's say, complex. But what we are trying to do is to, let's say, to reduce that effect of sanction which can affect, let's say, people's life. And as I have mentioned to you regarding intersectionality, we have evidence that sanction is, let's say, hitting the vulnerable population first, which is very common. But I'm considering this as a comment rather than, let's say, a question. And I'm thinking this is a valid point. Yeah.
Great. So another question by Masood, again related to what you, Jerg, presented. They said in the second paper on the dangers of civil war, you only focus on the external factors. Civil war in all countries arise due to the internal conflict and particularly the weakening of the central government. The internal dynamics in Iran due to the duality of the state are more dangerous. So that is kind of comment and or point that you want maybe to reflect on that, Diego.
Yeah, very briefly, to the extent that I understand the point, I would even be broader than that, and I would say all the conflict measures that we are interested in are about internal conflicts. So it's about internal dynamics. So what we are interested in understanding is how these internal conflicts are affected by external interventions. And that is what sanctions try to create. They try to create a situation where different factions in a country fight each other. So they try to create discontent such that the government is under pressure, not under pressure from the sanction-sending country, but under pressure from people within the country. So all of these naturally aim at creating domestic conflicts. And that is exactly what we are trying to study. So this is not saying that there's not other sources of all of these domestic conflicts. What we try to understand is, do sanctions add to these existing conflicts?
Right. Masood is also online, so maybe he can also continue with this question.
I mean, my point was that, for example, your measure of from World Value Surveys about Iranians because of external attacks becoming more nationalistic. This is all true. But if you look at the case of a country like, for example, Sudan, what's happening is really the conflict starts from within the state itself at some critical stage. And the point I was making is that, for example, if you look at the budget of the central government in Iran, it has really, really diminished. So this duality of the state, when I say, is that there is a danger at some critical point that if the central government, due to its lack of resources to pay salaries of the army, etc., and its civil service, and then we have another parallel state which command a lot of resources, and actually they also, what the point I'm making is that they are themselves the reason for the squeeze of the central government's resources. So in a way, this is the danger, which a conflict, when it starts from within the state structures, then it's it's nothing to do with whether Iranians are nationalistic or not. When the war starts, like in Sudan, there are the two armies fighting each other or from different regions. So this is the danger, and I think it's very important to strengthen the central government and to centralize governance in Iran, which it's not there. So that was my point.
Thank you, Masood. I guess this is
Uh,
important.
I think it's also an important point that nationalism, of course, is not exactly standing behind your government. You can be also nationalist and want to have another strong government. So in that sense, our question provides some evidence, but it's not a perfect question. So I'm there totally with you. When we are measuring nationalism, it's not support for that particular government necessarily. Yeah, it's not. The rally around the flag effect can look differently, and we don't have the data to fully understand it in Iran.
So I saw Hashem Pesaran also raise his hand. Maybe I invite you, Hashem, to join us and ask your questions verbally. Right. The Piruz also. Okay, Hashem is here. Okay. Maybe Hashem. Yes.
I mean, I didn't know much about the first talk. I really enjoyed it. My problem is, I'm really about the first talk, to be honest with you. It's about, we know that when there is hardship, economic conditions is not that good. Now, it could be because of sanction, it could be because of mismanagement of the policy and other reasons. I mean, it's usual question. I'm sorry to say this is usual. I mean, how do you decide how much of what you're observing, which obviously correct, that life expectancy has gone down, blah, blah, all of that. How do you separate the two effects? I've also a question for the second speaker, but I mean, I'm happy to first listen to you. Thanks so much for your very interesting talk. I didn't know how important those effects have been.
Thank you so much. Thank you, Dr. Pesaran. The point of mine is that initially, I should say, it is very hard to say this is a cause and effect relationship. Okay. This is the tool that we were working with recently, and one of those tools that I showed you, we said that what is, let's say, which one of these worsening during sanction. We did not say it is because of sanction. I want just to clarify this. Then initially we had a tool in the, let's say, World Health Organization. They produced a tool on the cut of the foreign aid, in particular ODA, which is recently let's say, one of the phenomena that we can see. And over there, it is very clear, this is the budget cut, but it is not overcompliance. It is not chilling effect. It is not blockage. It is lack of resource. When I'm comparing these two, what I have seen in different countries, and compare it with the, let's say, budget cut versus sanction, there are a bunch of things on top of that.
Yeah,
and doing this, I think many of us had the problem with this overcompliance in the, let's say, in the regular banking, let's say, accounts, that they are asking from where you are getting this money from, because of, let's say, money laundering. And I want to say that initially, I do not want to say it is cause and effect. It is, let's say, exactly what happened during sanction. And then the other point is that, but the items that I can see, let's say, very simple things in the license of the digital softwares, what they should use in the, let's say, MRI machine.
Yes.
How you want to update those. The case of North Korea, they have the money, but nobody sell it.
I got it. Yeah. I understand. Obviously, I saw for the work I was looking myself that when you have hardship in terms of budget and so on, the government priority would be towards more essential thing for the regime itself, and like some sector of economy, like, I don't want to go mention, is they going to suffer? And obviously that the effect would show up sooner or later, right? I agree with that. Anyway, can I ask a question about the second speaker? When I first Iranian Revolution happened, I went and studied theories of revolution, and I actually wrote an article under a pseudonym. And one thing I learned that, in fact, the deprivation theory of revolution doesn't work. And sanction is an example of deprivation theory. I don't know how much, I mean, I'm not a political scientist, but I got just interested. So, then I came to my own conclusion that, for example, Iranian Revolution arose because things are doing well and people are expected to things better and didn't get better. And people could afford to come, 2 million people come in the street and not worry about their livelihoods. Whether they could get bread at home or whether they can send their kids to school. And you know what I mean? The conditions were economically very favorable to protest. So when you put sanction, maybe that's what you're also observing in your result. When you put sanction, you actually is like increasing deprivation. And the theory, the Marxian theory of deprivation, which a lot of people believed, at least I don't believe it. I don't know whether you have looked at it from this angle, or maybe that's what your theory is looking at. I'm not sure.
Yeah, so I mean, the question is, deprivation theory doesn't work. Then the question is in terms of predicting which outcome. And that is exactly the story that we are interested in. If your outcome of interest is whether people just protest, whether you see people complaining and maybe organizing against specific government policies where they feel disadvantaged or where they feel the government is not doing enough to mitigate the consequences that they are facing when there are gas shortages, food shortages, whatever, that we observe increases. But of course, what deprivation theory might be more focused on is the question, does a serious conflict break out? Is the government removed? And this is exactly what we don't observe. We observe the opposite.
So basically it matches what I had realized many years ago anyway, which is very good. Thanks so much.
We are just providing evidence for your insights.
Thank you.
Thank you very much, Masood and Hashem, for your sharing your experience, historical experience also as well. By the way, I'm not sure if before revolution, the economic condition of Iran was booming, because we also had a couple of years of significant inflation and inequality and so on and so forth, just a few years before revolution. But that is needs a different panel to discuss about the economic roots of Iranian revolution in 1979. So I think Piruz also had one final comments, and I guess we can, after that, if there is no other further comments, we can conclude the panel. So Piruz is saying that my question regarding ethnic groups is related to the same point Behnam Atta was making. Some groups might become more patriotic, but that does not mean that the winning group grievances are diminished, if I read it correctly. So
yes, I agree with that, and I think that this is not supposed to be a contradiction. I think you can experience the grievances and still a share of the population rallies behind the government because they are saying we experience these grievances, but we attribute blame not to our government but to someone else. Regarding the ethnicities, as I said, there are very, very broad, crude categories only in the World Value Surveys, but we'll take a look at it whether we can say more about that. I cannot quickly tabulate the data right now.
All right. Thank you very much. I see no further comments, questions. If Reza or Jerg, you want to have some final reflections on sanctions and health, or
I just want to thank everyone for the great questions and comments.
I thank you for coming to panel. Reza, what about you?
Well, thank you so much. The only thing that I wanted to say regarding the last comment of Dr. Pesaran is regarding, let's say, I'm thinking when it is the, let's say, the time for looking at the effect of sanction, I mean the causal effect, it is going better to look at the across countries, let's say, data. When we want to look at the mechanism, we can go and deep dive each country, what is happening, let's say, on banking, on, let's say, on over complaints or chilling effect, those which are very specific to understand what is happening. I just want to mention that this is my way of thinking, that what is happening at the, let's say, international level, at the data across countries, and at the, let's say, at the national country, when we deep dive on one case. Yeah.
I'm sharing also a piece of opinion we just published today in Al Jazeera, in which with Mazia Moradi and Ruth Gibbon, I had the pleasure of writing that on effect of sanction on the health of Iranians. So I sent the link in the chat. So with this, I would like to conclude this panel, and thanks everybody to join us today. Sorry for a late announcement of the webinar. But we try for the next webinars also to inform you more in advance. I guess we have not yet planned for the December, but we are going to also try to fix our last webinar in this year in 2025 during the second Wednesday of the December, and definitely we make sure that you get the information on time about that as well. So I would like again to thank the two speakers, Professor Reza Majdzadeh and Professor Jerg Gutman, for accepting to share their studies and views on this important topic, especially for case of Iran. And yes, with this, say goodbye to everybody and hope to see you in our next webinars as well. Thank you very much.